Welcome back, everyone. For those of you who are just joining us for this session, welcome. My name is Jill Goth. I'm the Programs and Policy Manager for the Kidney Foundation in Southern Alberta, based in Calgary. This topic for our next session is complementary and alternative medication for kidney patients. So once again, please type any questions during the presentation into the chat box, which you can access by clicking the chat icon on your Zoom toolbar. I noticed actually in the chat before, if you don't know where your toolbox is, sometimes you have to wiggle your mouse and then it'll come up at the bottom. So please bear in mind though, that we can only answer your general questions. Any inquiries about individual medications or protocols, they need to be addressed by your healthcare team. And so now it's my pleasure to welcome our presenter for this session, who is Joyce Nishi. And Joyce is a pharmacist at the Medicine Hat Regional Hospital, a 200-bed hospital that is part of Alberta Health Services. Her key areas of interest are teaching and precepting pharmacy students and pharmacists, as well as teaching and working with patients. Joyce has been working as a kidney pharmacist since 2019 and has been practicing since before the invention of the smartphone. For you, Joyce.
Yep.
Although she grew up on a farm, she cannot ride a horse, she cannot rope a steer, or she can't back up a trailer, but she can navigate a gravel road with the best of them. And her expertise in her field speaks for itself. So welcome, Joyce.
Thank you. Okay, so just share my screen. Okay, so this topic is entitled, Does Green Mean Go? And I think by the end of it, you will realize that maybe green does not always mean go. And we're going to define what complementary and alternative medications are and what you should be watching out for as a kidney patient. And I would like to give credit to Seth Ontkeen, who was the previous pharmacist who gave the bulk of this presentation, and I have his permission to redo this. So can everybody, so Jill, is everything working fine?
Yeah, it looks like the presentation is not up yet.
Oh.
I'm sure that it is
on here
on as we speak.
Yeah, let's just. I knew this would happen, but so. Okay, can you see that?
Yeah, we can see that, Joyce.
Perfect, good. Just go from the beginning. Okay, perfect. So everybody can see everything, everybody can hear everything. Good. All right, so there is, I think, a good saying as we travel through this presentation is, and I'm going to flip this around a bit. So Walt Whitman said, be curious, not judgmental, but I also think that if you're talking about health food and natural health food product claims, we have to be a bit careful, and maybe we do have to use some judgment with this. So this Vincent Andrews, he gave a presentation a couple of weeks ago, and this really resonated with me. He was talking about COVID vaccines, but I think this also applies to natural products as well. And his quote was, be mindful of the source of the information that you're getting. So I think that will be another theme as we discuss natural products. As Jill has already mentioned, the information provided here is general in nature. Everybody should consult their own renal team for individual advice because you're all on different stages of this kidney journey and they know you the best. The other issue that Seth and I found was that when we talk about what works or doesn't work, we talk about evidence, and good quality evidence is sometimes really hard to find because it's put out by whoever is making the product. So when you think about that, somebody is trying to advertise or sell their product. And I guess another big takeaway after this presentation is if you want to try any herbal product or supplement, and we'll also be talking about cannabis later on in the week, it's always really important to discuss this with your healthcare team, because I think we all kind of need to know what each other is actually taking in terms of medications. Okay, so basically today what we're going to talk about is what are supplements, what are complementary medications. I thought we'd step into a little bit about why do we want to supplement, because I think that brings up some interesting ideas as well too. I've just got this big beware, because we're going to talk about what you have to watch out for. And as a pharmacist, what I'm always concerned about are drug interactions, especially with kidney medications and transplant medications. And then we've got helpful in quotation marks. So Seth and I tried to find what was information that we could find about melatonin, turmeric, and vitamin E. So I'll talk about good and bad about them. And then I'll share some good resources. And then I think they will also get put into the chat box. All the links will get shared. So is Chantel on the call as well too right now? Doing the polls?
I'm here. Yes, I am. I can launch the poll if you'd like.
Yes. So why don't we launch the first poll? Okay. So we just basically want to get a sense of have you ever asked anybody before if you've taken something or not? Or have you kind of just said, oh, I know I'm going to get yelled at, so I'm just going to not say anything? Okay. All right, so Chantel, if you can close the poll. Okay. All right, so most of you, actually the majority, 68% said you've asked somebody if it was safe. What I would like from this presentation is the remaining 32% of you, next time you want to take something that you feel comfortable and safe, asking your renal team if it is safe to take this medication. Okay, thank you. So do I just close this now, Chantal? Okay. All right.
Should be closed now, the poll.
Okay. All right. Thank you. Now, why is this not? Okay. All right. So first of all, what are supplements? So I think we wanted to just lump everything into here, because when we talk about complementary health products, this also includes natural health products. And people go, well, what does that mean? Well, that includes things like herbal products, vitamins, minerals, probiotics, and even prebiotics now. And it's kind of blurring into some of these new kind of nutraceutical supplements that are sort of supposed to be more dietary, but they have some active effects. So when we talk about complementary, what that means are any of these things that you take that are not a prescription medication, they are used in conjunction with conventional mainstream medicine. So, you're a dialysis patient, but you decide you're going to take some supplement, and your team says that's okay. There's a slight difference in that alternative therapies are used totally in place of regular medicine. And so when you're reading about this, you'll see that these terms are used interchangeably, complementary and alternative, but they do mean slightly different things. So I would say most of us use complementary health food products, right? That we're using both regular medicine and choosing to take a supplement. Okay. Chantal, can you launch the second poll now, please? Okay. So, have you ever searched the internet for information on the safety of a medication for a kidney patient? Okay, Chantal, I think we can end this poll. Thank you. Okay, and sharing the results, we're seeing that, yes, a lot of us, 71% have gone onto the internet to look for information on the safety of medication. And so we're going to bring that up as well too during this discussion. Okay, so Chantal, can I just close this now?
Yeah, I'll close it for you.
Perfect, thank you. All right, so I guess we want to start by looking at why do we want to use supplements? And before I start here, I just wanted to shout out, I don't know if Buzz, one of my patients, is on this conference, or Dr. Hyde, because I heard he's listening as well too. Anyways, I think why we want to use supplements is it's giving us a personal choice. I think with prescription medication, sometimes you feel like you have no choice or little say in what is given to you, versus when you take a supplement, you're kind of having some autonomy in what you're getting to do. What's also really powerful are recommendations from family or friends, right? They'll, like your neighbor will say, oh, well, you know, I had kidney problems and I took X and it got better. And so everybody is always very free with giving out lots of information. And fortunately or unfortunately, sometimes we will trust family or friends more than we do our healthcare team. I guess one of the big takeaways with this presentation is buyer beware. If it sounds too good to be true, yeah, generally it's not true. And with going onto the internet, buyer beware, because products may not be regulated in Canada or standardized, but you can buy them over the internet and you can get them shipped from all over the world nowadays. So they might not meet the standards of what the Canadian government would like for supplements. And the one example that I'm taking from Barb Bancroft, she's a nurse practitioner, but she said in 2010, they did an analysis of 12 red yeast rice products. So these are sold in health food stores to help improve cholesterol. And so the labels on these products said there was supposed to be 600 milligrams of active ingredient, and they found the actual content was only like 0.1 to 10 milligrams. So you can see you think you're buying a 600 milligram product, and if there's only 0.1 milligram, that's like hardly anything. So you're paying a lot of money for basically nothing. Okay. So I also wanted to share a little story with you as well too, because, you know, when we talk about, well, what's a vitamin? So to me, potassium is not a vitamin, but one of our patients went to the health food store and they bought what they thought was a vitamin supplement, which actually contained potassium. So what happened was, for 2 years, he had high potassium, and the poor nephrologist was like doing test after test. The poor patients were going for test after test. He was changing like his prescription medications to get the potassium down lower. Finally, the potassium couldn't be lowered, so he had to get this medication called sodium polystyrene sulfonate. You probably know it as K-exolate. Patients have said it's like drinking cement. It's like very sludgy. It's like you take a powder, mix it with water, or you take this pre-made suspension, but it doesn't taste very good. So for 2 years, this went on. And then finally, the nephrologist said, you know, this just doesn't seem to add up. So can you just bring everything in your house that you're taking in, like as a like pill bottle to me? And so after 2 years, we discovered that this patient was inadvertently taking a potassium supplement and getting very high potassiums because of this. So this is why it's so important to speak to your healthcare team before you start any new therapies, because we could be using different definitions. You're thinking vitamin, and meanwhile, you're taking potassium, and it's not a good thing. One of the analogies that I've just heard that I love is think of your body like if you had 4 good tires, right? And if you've got one tire that isn't working very well, you still have to look at after all 4 tires. So in this analogy, diet still is the cornerstone of the supplements. So it's so important as the foundation that you eat your vitamins rather than buy them, unless recommended by your kidney team. And the reason why too is that foods provide better antioxidants, they provide fiber, actually taste better. And so I think this is a theme that you will find from many physicians, nurses, pharmacists, and registered dietitians. And so you're probably noticing a theme here. So ask the renal team for help. So I'm hoping that a lot of you, when you're wanting to supplement, you're having some conversations, especially with your dietitians about this. The other problem that we're all guilty of as human beings is if a little is good, we always think more is better. And this is definitely not true, especially with supplements. And one of the examples that we're finding is that high doses of vitamin C can increase the risk of kidney stones in some patients. And you have to be very careful because if you go to the health food store, they'll tell you like very high doses of vitamin C are good for lots of different things. And you always have to maybe mention your other conditions too, right? Today we're talking about kidney disease, but if you have heart disease or diabetes, there might be other reasons why you can't take a supplement. The dietitians really want you to focus like on what are the recommended daily amounts of vitamins. And so what might be appropriate for you as, let's say, just a kidney care patient, you're like stage 2 or 3, that you might need a different dose of a vitamin or a supplement than a hemodialysis patient who is different from a transplant patient. So what might be too much for one person is too little for somebody else. And I think we really have to be careful about labeling too. So as a pharmacist, I hear this a lot. I would I want something that's all natural. And then I always have to kind of remind our patients that many natural products are actually very powerful drugs. For example, opium, which is where morphine was originally derived from, that comes from a poppy plant. And some people want to use natural calcium, but they're finding that calcium from natural sources, such as oyster shells, can actually be contaminated with high levels of lead and other heavy metals. So with calcium, you want processed calcium because it's got less contaminants in it. So let's explore melatonin. So what is it supposed to do? Well, it's supposed to help you fall asleep, and our bodies naturally make it in our brain in response to when it starts to turn dark. And it's really important to help regulate our natural body rhythms. So because we naturally make it, now it's being marketed as a supplement. The interesting thing is, does it work? Some studies show modest benefit. What I've heard is that it helps the most in certain Alzheimer's patients that start to get confused, like when the sun is starting to go down. But for patients, for example, on dialysis, the data is all over the map saying it doesn't help, it does help. And I work for Alberta Health Services, and in our hospital, we don't carry melatonin because when they looked at what we call the evidence or the data, it just didn't really show that much benefit. So if you come to a hospital in Alberta and you want melatonin, you have to bring your own in. And how much to take, the doses really vary, but the typical dose is around 3 to 5 milligrams. Okay. And on average, what they found was may help you fall asleep 7 minutes faster and stay asleep for 8 minutes longer. So not a huge benefit. So is it safe? So yeah, I think it's generally safe. Some possible side effects are headache, and just about any medication that you take can cause dizziness or nausea or stomach upset. And some people can actually get some daytime drowsiness. Now, if you're a transplant patient, again, I would not take the melatonin unless you confirm with your transplant team that it's safe, because it may stimulate the immune system and impact some of your transplant meds. And also in general too, it interacts with other medications and can cause some additive drowsiness. So I think for those of us that cannot sleep, I think this is what we feel like. As soon as we are not supposed to sleep, we're like, oh my goodness, I can barely keep my eyes open. And then as soon as your head hits that pillow, you're wide awake. If you're having troubles with sleep though, please discuss this with both your renal team or your family physician or your primary care nurse to come up with some other strategies as well too. Another one that's actually very popular right now is turmeric, which is actually a spice. It's also called curcumin, and it is the spice that makes our curries kind of that bright yellow color. And what it's supposed to do is reduce inflammation. And for some people, they felt it might help with like arthritis, osteoarthritis, because it would decrease the swelling. And it might help with itch when sometimes you get too much urea building up in your blood, then it can cause itch. So they thought it might help with the itchiness. And how does it work? Well, it may inhibit some inflammation pathways. And again, the results are a little bit all over the place. For pain, they say it might help, might be as good as ibuprofen. For itch, it may help reduce the itch about twice as well as placebo. And how much to take, the problem is you have to take 500 milligram capsules 3 times a day. So is it safe? Yes, generally it's well tolerated. But again, if you're taking it as like a capsule rather than eating it in your food, you're getting a much bigger dose. So again, your biggest problems are stomach upset, nausea, diarrhea, constipation, gas. Again, with your transplant patients, we have to be really cautious because it can increase a medication that you take called tacrolimus, and it can affect your immune system. It may also lower blood glucose. So if you're diabetic and you're taking insulin, this might lower your blood sugar or blood glucose too much, which you have to be very careful about. And it also may increase risk of bleeding. So vitamin E, this one, as Jill's mentioned, I've worked for a long time. Its reputation is kind of waxed and waned. So what it was supposed to do was reduce muscle cramps, and it was supposed to be good for our heart. So I remember about 20 years ago, everybody was taking vitamin E. And they thought how it worked was it's an antioxidant, so maybe it will collect the damaging compounds so it won't hurt your heart. And what they found though was with the heart, it didn't actually seem to help. And now there's a few studies have actually said it could make your heart worse. For muscle cramps, they didn't find if it really worked well or not. And again, what we would like you to do if you decide to supplement is tell your team, but an average dose is only 400 units a day. So why that is because remember how we talked about is higher better. Well, doses above 400 seem to be linked to worse outcomes. And now we're saying patients with heart conditions should actually avoid vitamin E supplements. It also thins the blood. So people that are on warfarin, which is also called Coumadin, or people that are taking aspirin, that they can get extra bleeding. And so and also some transplant patients are still on cyclosporin, and that might interact with that as well. So it might help, vitamin D might help with leg cramp, but we're not too sure if it does or not. So drug interactions. So they can happen with lots of things. So it can happen between two prescription drugs, or it can happen between a complementary or an alternative supplement. So your vitamin or your probiotic or your herbal with a prescription drug. And what I really wanted to share too is that these interactions can be really, really important if you are taking transplant medications, because you've got like a kind of a target that we want to hit of how much transplant medication we have in your body, and any drug that can make it go too high or too low is a dangerous thing. So I've got this cannabis plant in here, but that represents also herbals, vitamins, probiotics. So bottom line is, if you start combining prescription drugs and complementary drugs, supplements, they can increase the effect of your prescription medication or increase or decrease the effect of your complementary medication. And so sometimes then it's just this big puzzle and we don't know what's going on. A couple of things I really wanted to mention with kidney patients too is that you have to be really careful with supplements, because some supplements, as we've mentioned, can contain high levels of potassium. And usually with kidney patients, we want to be very careful about how much potassium you take. As well, some supplements can contain high levels of phosphorus, which we want to avoid. And sometimes think about it as, if you take a supplement, you're making that kidney work harder to get rid of the supplement, or it actually can just on its own damage the kidney. And then the other issue that we're finding is it may contain unlisted ingredients. There's like a lot of erectile dysfunctional meds that you can buy on the internet. And what they're finding is that a lot of them, rather than having whatever supplement is supposed to be in there, they've actually mixed in active drug into it. And so that's what's, and it's not listed on the product at all. And again, if you're going on to the internet, I was just Googling this, but like I found this tea for kidney inflammation. And the interesting part was this tea for kidney inflammation contained horsetail and barberry, which should be avoided according to the National Kidney Foundation. So it's interesting, right? Something that's being sold to help your kidney is actually not good for the kidney. So then you're thinking, well, geez, Joyce, you're kind of a downer here. What should I do? So what I would suggest is, again, be suspicious, be careful. And here's a couple of things that you can go look at on the internet. So I'm going to kind of go to the BC Renal Agency first. They have some really good information on especially non-prescription medications. But what they did was then they took their top 50 herbal medications that people said they were using the most often, and then they made a separate website called the Herbal CKD website, and I'll show you that in a second. And then Alberta has My Health Alberta, which has just general information on it. And then Mayo Clinic is a Good American hospital. And then of course, National Kidney Foundation also has some good information on herbal supplements. And just be very careful about using Dr. Google. I think Dr. Google can be very beneficial, but can also be very harmful. Okay, so in conclusion, I'm just saying that complementary, which I also mean herbal or alternative products, may not always be safe, but I think it's important that if you feel you want to try something, that you talk to your healthcare team about it, and they can give you some advice. the Herbal CKD website, they've broken it down into, so you've got your pre-kidney, like pre-dialysis patients. So these are your chronic kidney disease patients. And then they have hemodialysis and peritoneal dialysis patients. And then they have your transplant patients. So in this example, what is safe in a chronic kidney patient is not safe is possibly not safe in a transplant patient. What can also help you if you're wanting to buy a product is, I would say, yeah, be very careful about buying it over the internet. Look for a natural product number, but just be careful too, because the companies are very clever. The natural product number looks more official, right? So then you think it's safer, but like the Americans say is, they're just saying that the ingredient is on there, but they haven't actually approved it for safety. Okay, so that is that. One of the pre-questions that I had was, I think somebody was asking about which vitamins or supplements should you be taking as a kidney patient. And I think the answer really is dependent on yourself, where you are in your kidney journey, and what other medications you're on and what other medical conditions you're on as well too. And that's why, as Jill said, it has to be individualized for each person. Okay, thank you.
Joyce, we've got a few questions here,
Sure.
and we have a little bit of time. So, you know, obviously people had lots of specific questions about specific items. Maybe a couple of these out, but before we started, before I go further, there was a question about cannabis and about why people would use cannabis, but I just wanted to mention to everybody that we have a session on Thursday specifically on cannabis in the kidney, what you need to know, and Joyce will be part of that conversation as well.
Yes.
So maybe, I don't know if you want to touch a little bit on that in case people can't come, about why people would use cannabis, and then we can go on to some other specifics.
Oh, okay. Yeah, so in summary for cannabis, why people are wanting to use it is there are some actual indications where cannabis may be helpful, but I think what's happened is, like, cannabis got lumped in this big category, but there's, like, you can smoke it, you can eat it, you can chew it, you can do lots of different things. And it's sort of trying to get regulated. There are, for example, children with epilepsy, there's a specific form of cannabis, so it's like purified, but it is actually used to treat pediatric epilepsy. Now, what we're going to be talking about, Dr. Capel and I, in the cannabis presentation is sometimes, though, especially for transplant patients, there are some concerns with the use of cannabis. And also, when we're talking about drug interactions with all the different types, there are some interesting interactions that are happening. I guess the biggest one, which is kind of obvious, is because it can make you sleepy, right? And then if you're taking other medications that are, making you sleepy, is that combination just causing too much sedation?
Okay, thanks, Joyce. Maybe there's just combining some questions related to maybe some oils. Somebody had a question about oil of oregano, pros and cons, and someone else was asking about high quality essential oils like doTERRA, like lemon oil in their water. Could you speak to that?
A little bit. I think I'll maybe defer that to also them speaking to their dietitians, because I don't know a lot about essential oils. I think what we have to be careful, I think they can be effective, but essential oils are actually very concentrated. So I think that's the takeaway, is that you just have to be very careful about how much you're using, because they're actually quite strong. The oil of oregano, some people swear by it. I'm not too sure how effective it is. I think if you want to try it, please bring that up with your team. I know we'll talk about it in the next session too, but I know if Buzz is out there, like when we were talking about cannabis and cannabis oil and things, he said, yeah, like it's really expensive. Like, so I don't know how expensive essential oils are too, but they get quite pricey, right? So again, yeah, I don't have a really good answer except just be careful because they are very strong, and please check with your team before you use any of those oils.
What about collagen, Joyce?
Okay, yeah, we're sort of veering into that nutraceutical kind of supplementary thing. And so I would say I don't know enough about collagen at this point in time. I think maybe Jill, what a nice session would be next time is about like all these kind of, you know, they're supplemental like powders or collagens and, you know, all these things that prebiotics, probiotics, you know, what role they have in our patients.
So safe to say at this point with specifics like that to check with the pharmacist and care team.
Yeah, and I almost think the collagen should be actually more of a dietitian, like a registered dietitian question about the collagen.
Perfect. I'm going to read this one, and I hope I pronounce it correctly. Is AKG the same thing as L-arginine, and are they used to treat kidney disease in any way? This person's talking about how they've come across some science-based articles and not clear about what the benefits might be.
I think, you know, I'll have to confirm this. I think the L-arginine is like an amino acid, and I think it for some pediatric, again, rare pediatric genetic condition, there might be a role for L-arginine, but again, I don't know if that translates into, you know, just an average adult patient. Yeah, so I guess, yeah, I'm not too sure, Jill.
Not sure.
Yeah.
We'll keep testing you.
Yeah, okay.
But you know, you've given lots of resources, and just a reminder that all of these sessions will be recorded and posted on the site if you didn't get a chance to write them down, the resources. But people are some people are asking about how where are there good places to check into, and is WebMD somewhere that you would suggest checking into, or maybe?
Yeah, I think, WebMD possibly, and the other one I use a lot is Medscape. Yeah, so I think if you look there and it's kind of confirming what you're thinking, it's good. What you have to be careful of is if you've got, like, let's say Dr. Green has his own website and Dr. Green is selling you his special vitamins which will cure X, Y, or Z. Those are the websites that you want to be very cautious about, right? Because there's a clear conflict that someone is trying to promote something but also trying to sell it to you. Yeah.
I wonder, Joyce, if you could speak a little bit to, you know, especially for some people who are fairly new to kidney disease, or maybe people who are changing treatments, you as your role as part of the kidney care treatment team, what don't people know about pharmacists and your role that you think would be helpful to them?
I think our role is that we work with you, the patient, and the rest of the kidney team to kind of get a true sense of what you're actually doing, taking, both in terms of non-prescription, like complementary medications, and prescription medications, so that when there are decisions made about changing your medications, we know that we're basing it on what's reality, like what you're actually doing. And then sometimes we're kind of detectives too. Like if something doesn't seem right, we will sometimes work with the nurses and the team to just kind of dig through and go, well, okay, for example, you're supposed to be taking this blood pressure medication 3 times a day, and your blood pressure is going up. What's going on? So we might ask you to bring in your pills and then confirm like how you're actually taking things. So yeah, so I think that's the biggest part of our job is just to kind of get a sense of what are you actually doing as a patient, so that we can then accurately respond to that, from a physician point of view, a nursing point of view, a dietitian point of view,
Okay.
or even social worker point of view, right? Like you've run out of your meds, but you didn't feel comfortable telling anybody, but you told me. Well, then I'll work with that.
Great.
Yeah.
Just maybe a couple of more minutes here. Can you speak to probiotics?
Yeah, there's, I think that's a very interesting field of research, and there's actually prebiotics now too, which is another really interesting area of research. And I think the problem is everybody's kind of jumped into it, just like with cannabis, right? There was some data, but because there's money to be made, everybody is running in with different prebiotics, probiotics. I kind of explained it to my nurses saying prebiotics or probiotics, it's kind of like antibiotics, right? Like it's a big class of medications, and there are definitely what there are is different probiotics used for different conditions. So you can't just lump them all in together. There are specific ones that contain specific bacteria, which are better to treat a certain condition than another one.
Maybe just one last question, Joyce, here.
Sure.
And again, reminding people that they can always reach out to their care team with their additional questions. What would you say related to herbal teas?
So I think how it depends on what you define by herbal teas as well too, because what some people have said is, you mean I can't drink my peppermint tea? And I'm like, no. So, anything that you can buy like on a grocery shelf, like Rubius tea, even, green teas, those are all safe. But it's just like, well, 2 things. It's like if you drink too much coffee, right? How do you feel? So again, with the herbal teas, if you're drinking things from a grocery store, that's fine. It's when you start going into that, they're kind of like actual medicated herbal teas that you can buy from like, the health food store, like kidney tea that I showed you, or like, there's like Chinese herbal medicine with all the different herbs in there. Because of the kidneys, there's like, we're worried about like the potassium content. We're worried about actual, is what they're saying even in there. So that's where, so regular herbal teas, everything is just fine. More of the medicated herbal teas I would avoid.
Perfect. Well, thank you, Joyce, so much for your enlightening presentation on complementary and alternative therapies for kidney patients. So once again, for further information, please reach out to your regional Kidney Foundation branch office through our website, kidney.ca, or you could send us an email at kidneyprograms@kidney.ca or program@ren.ca. And now I'm going to pass this along to Daisy Escato, who will be moderating the next session.
Okay. Bye, everybody.